important to understand because every thought we're generating waves. And if we're generating positive thoughts, those are positive waves. And that has an immediate healing on our body. In other words, our body is so porous, those waves readily penetrate the whole body. And then if you're having negative thoughts, those are negative waves, and that has an immediate detrimental effect. And if you have the TV news on in the background, you know that's a negative energy scenario coming in your system. So you want to guard against.
Hi, I'm Dr. Monica Jauregui, and welcome to Truly Healthy MD. I have one question for you. What's really behind the way you feel? As a functional medicine doctor, I'm passionate about helping you uncover the hidden causes of your health concerns and finally connecting the dots. From balancing hormones to overcoming Lyme disease, boosting brain health, or just finding new ways to feel your best every day. This podcast is packed with insights and strategies to help you take control of your health and live wholly. Ready to explore what's possible and be truly healthy? Hi, this is Dr. Monica Jauregui from Truly Healthy MD. At Truly Healthy MD, we empower patients to become truly healthy by addressing the root causes of illness with cutting-edge medical science and holistic healing. Welcome to our podcast. Today we have Dr. Jim Roach as our guest. This is going to be such a great conversation. Dr. Roach is known as America's healer. He is a leading expert in integrative, holistic, botanical, spiritual medicine. His latest book is Brilliance, The Pursuit of Hope, Wisdom, and the Divine. A best-selling author, Jack Canfield, described Dr. Roach as one of the most encyclopedic minds I have ever met. So you can look more information up about his books, about his conferences, about his newsletter at www.drroach.net and also at www.themidwaycenter.com. Thank you so much for being here on our podcast, Dr. Roach.
Well, I'm so honored. Well, thanks for the invitation.
Excellent. So, like we were talking about right before we went on air, we were talking about cancer. I had such a hard time choosing of the many topics that you're so knowledgeable about. It was so hard for me to choose which one, but I do think that talking about cancer is something that's going to be super useful for me as a physician as I grow in my integrative journey. And for our listeners, this is something that's really hard to get enough information on. There's very few integrative physicians that actually practice this, so it's hard to know where to get your information. So I'm so happy that you've come on this podcast to help us talk about it. So what would be the initial things that you think patients need to know when we talk about these strategies in cancer?
Well, number one is peacefulness. So there was research, for example, with mice where they implanted breast tumors and they stressed one group of the mice, and the group that was stressed had a 30-fold increase in metastases. When they gave the drug propranolol, that's a beta blocker that blocks adrenaline, that prevented most of the metastases. So number one with my patients is peacefulness. I want them to be at peace 24/7. And well, how do you get into a peaceful state with that? Well, number one, I share that I've had 104 patients with spiritual near-death experiences. And they report the other realm is more real than this realm. They get mad about coming back. They're not afraid of death anymore, become very mission-oriented and focused with that, right? So I point out the downside for you in this situation is ultimate bliss, is what my patients are reporting. Now, your family wants to keep you around, but you're going to be fine, right? That's kind of the worst that's going to happen with you. I also use supplements to help with that. Chamomile tea is calming, relaxing, has anti-tumor qualities to it. Inositol, vitamin B8, in the form of inositol hexophosphokinases, that's inositol IP6, it lowers estrogen and dihydrotestosterone, which is helpful. But research suggests that it inhibits angiogenesis, growth of blood vessels and tumors, and also inhibits metastases. So those are excellent ways to support peacefulness as well. Number two is actually circulation. So with the diagnosis of a tumor, you have a 4-fold higher risk of heart attack and stroke. You have a 10-fold higher risk of thrombophlebitis, pulmonary emboli. Okay. So it doesn't do any good to be managing your tumor and then you have a heart attack or stroke. That kind of defeats.
Yeah, absolutely. Yeah, that's so important when we're
holistic doctors, a lot of times I feel like in conventional medicine, we kind of get blinders on, right? We're like only looking at this one thing. We forget to address all the other things. And then people end up getting sick and dying from other things. So always being so mindful of the other things that our patients can get sick of. So this is so important.
So the most important thing is peacefulness. Research was done with mice where they implanted breast tumors, and they stressed one group of the mice, and the group that was stressed had a 30-fold increase in metastases, spread of the cancer. And when they gave the mice propranolol, a drug that blocks adrenaline, that prevented most of the metastases. So, in other words, the worst thing when you're diagnosed is to not be in a peaceful state. We need you to be relaxed
Yeah.
right away. And that doesn't always happen when you first see the oncologist. But,
Absolutely. Yeah, that's so important to know. And I always
right,
love when we start with non-pill things, right? I think as physicians,
right.
we're so a knee-jerk reaction is to prescribe medication or even supplements for everything. But if we can start with those things that are
Yeah,
don't involve taking a new pill, that's
right.
so important for people to have in mind.
So I've had 104 patients who've had spiritual near-death experiences. They report the other realm is more real than this realm. They get mad about coming back. They're not afraid of death anymore, become very mission-oriented and focused with that. And so they're reporting that the other realm is ultimate bliss for the most part. Now, I've had two with negatives. One was an alcoholic. He had a negative story. But I tell patients that the downside of the situation is ultimate bliss for you that my near-death patients report. So that's the worst that can happen. So I'm working for your family. They want to keep you around, but you're going to be
Yes.
fine regardless, right? And that helps keep them in a more peaceful place. So
Mhm.
getting in a relaxed state involves setting a lifestyle that involves getting rid of adrenaline in healthy ways, like physical activity. I encourage my patients to walk an hour a day, for example, and at a pace where you can get 1 sentence out, but not 2 sentences out is the pace. So it's not a walk the dog pace. It's a little bit faster than that would be optimal associated with that. And then I think prayer, meditation are very important. Personally, I meditate for 30 minutes every night before bed. And a lot of individuals like you and I, our brains are going in circles rapidly. And it's important to slow down that brain to get into a calm, peaceful place. So meditation can be difficult at first because you're spending so much. But as you practice over time, it slows down. You grow parasympathetic fibers to keep you in a more relaxed situation. And so
Yeah.
it definitely helps get you in a more relaxed state. You want to be in a positive energy environment. We are just energy, quantum physics has taught us E equals MC squared. We go back and forth between matter and energy, right? With this, and actually, even when we're in matter, imagine an atom being 1 inch in diameter, and the diameter of the atom being 1 mile. So even when we're in physical form, we're 99.999999999% hot air with that. And
Yeah, it's so
again,
hard to conceptualize because we're just so used to like it feels like we're dense matter, but we're not.
exactly. And in fact, we may go 20,000 times back and forth between energy and matter every nanosecond,
Oh
right?
wow.
But we're so porous, and that's extremely important to understand because every thought we're generating waves. And if we're generating positive thoughts, those are positive waves, and that has an immediate healing on our body. In other words, our body is so porous, those waves readily penetrate the whole body. And then if you're having negative thoughts, those are negative waves, and that has an immediate detrimental effect. And if you have the TV news on in the background, that's a negative energy scenario coming in your
Absolutely.
system. So you
Oh
want
yeah.
to guard against negative energy in your environment and realize that your thoughts not only impact you and those around you, but actually radiates out into the universe, affects the whole universe. Every thought affects the whole universe. But it's my belief that if you can have positive thoughts 24/7, that you can probably heal any disorder just by that mechanism with that. But of course, how do you obtain positive thoughts 24/7? Well, number
It's
one,
mhm.
set that intention. Before you get out of bed in the morning, say your prayers, set your intention of what it is that you want. For example, if you have grandchildren, you might envision them, pray for them being there when they graduate from college, right? You want to smell that, you want to taste that, you want to elaborate on that image as much as you can. Elite athletes, if they want to win the race, they do what? They visualize winning the race. Because they visualize it, that in fact improves their odds of winning the race. Same principle here. We're creating our reality. We're literally surrounded by waves that don't particulate until we observe them. And that's research from the double slit experiment that was done 60 years ago. So that's, accepted science at this point.
Yeah, that's
So
scientific
positivity really.
achievements from decades ago that we haven't fully embraced in our day-to-day thoughts about this.
Right. And so I also encourage patients to make an angry list of everyone they've been angry with their whole life, send love out to those people on a daily basis, forgive 3 people every day, and maybe ask for forgiveness from some on a daily basis. 10 things you're grateful for every morning, 10 different things you're grateful for every evening. And if you have low self-esteem, write down 10 things that you love about yourself every day, because you were created perfect and you always will be perfect. And one of the big lessons of life is that we are not our physical bodies, right? That we are our spiritual essence with that. And so things happen to our bodies during our life. And ultimately, the lesson is that does not matter. In fact, everything in life is a lesson. And the key thing is not to have to repeat the lesson to learn it the first time. Everything in life has a purpose. And so as soon as we recognize that, and as soon as we can develop unconditional love, where if we can love 24/7, and if we can be grateful 24/7, and if we can be authentic, open up that throat chakra and speak our wisdom, because we've gained a lot of knowledge through this life. We're not supposed to keep that a secret. We're supposed to share that to make the world a better place. So those, of course, what happens when you have a negative thought? You have 17 seconds to cancel that before it snowballs into a second and third negative thought. So you can say cancel, cancel, and then move out of your head. So your brain's supposed to solve problems like changing a tire on a car, but it's not supposed to get tangled up in emotions. That's your heart's business, right? So taking, 2 or 3 kind of chest belly breaths, you can do this right now as you listen in onto this. And as you do that, move out of your head and into your heart space. And your heart's about love and peace. And that allows those emotions to fade away as you move into your heart space with that. So those are key strategies to benefit from understanding the reality of the universe and the reality of the creator, and that we were created perfect and we've made no mistakes and we've missed no opportunities. Everything is happening just the way it's supposed to happen. And
That's
so we don't
such a
get to
peaceful
die.
thought.
Yeah.
Yeah.
Well, we don't get to die too soon. My near-death patients, they get on the other side, and dozens of them have said, what? They're told it's not your time. You have to go back down. We've had dozens of patients share that. And so there is a right time for death. We have expiration dates on our body. And to be honest, I've had 2 patients. One was a cancer patient, and she's still with us, who was told by God, God said, you can check out now. And she said, well, thank you for the opportunity of checking out, but I've got this grandson. I want to be sure they get raised in the right way. But subsequently, she had 2 horrendous surgeries. Her business collapsed. Her husband went on dialysis. She went back into hospital with sepsis. And then she understood that, yes, there's a reason why she was given a chance to check out. There's another patient that I had. He had a fever of 105 for a week. He was on IV antibiotic. Nothing was working. And then his fever went to 106. That was the day he was supposed to die. Well, he was told that later by 4 predeceased buddies who were supposed to greet him. And what happened was nothing to do with him, but there was a nurse taking care of him who, this was the first seriously ill patient she'd had. And she said, if he dies, I'm going to quit nursing. So he survived not for himself, but so she wouldn't quit nursing with that. But since then, he's had severe autoimmune issues. And to be honest, he would have been a lot happier if he'd moved on the day he was scheduled to die. So we don't get to graduate prematurely, right? We have to complete our spiritual mission here on earth before we can move on.
That's great to know. That's very comforting too.
Yeah. And so the second most important thing is circulation. Uh, and and by the way, strategies for peacefulness can include chamomile tea, and there is a supplement, an inositol IP6, which is vitamin B8, that when used 3 times a day at bigger doses, it works as well as SSRI antidepressants for anxious depression, for example.
That's great to
But
know.
yeah, number two, circulation. With tumor diagnosis, you have a 4-fold higher risk for heart attack and stroke, and a 10-fold higher risk for thrombophlebitis, pulmonary emboli.
Wow, it's a lot.
So it doesn't do any good to be successful with your cancer and then to have you die with a heart attack or a stroke. So it's key to investigate that right away. I do comprehensive blood testing to assess that. I look at D-dimer levels. I look at fibrinogen levels. Those are clotting markers. And I compare that to C-reactive protein because inflammation can cause those markers to go up some.
Mhm.
And
Yeah,
right away, I get patients on support for circulation. Fish oil supports circulation, for example. And really, most botanicals all promote circulation, like turmeric supports that. Vitamin D reduces fibrinogen levels and is helpful. But systemic enzymes are the most important thing. And bromelain is the one we typically might use on an empty stomach. Now, if you're on a blood thinning medication, you may want to be cautious about using bromelain on an empty stomach, but it's derived from pineapple stem, relatively benign. And so I would start patients on maybe bromelain 3 times a day, empty stomach. If you take it with food, it acts as a digestive enzyme. You don't want that. You want it as a systemic enzyme. So first thing in the morning, last thing at night, and typically mid-afternoon. But monitoring D-dimer fibrinogen tells you how aggressively you need to support circulation. And now hydration is important too, right? If you're not drinking enough water, your blood is thicker. And if you happen to consume some extra amounts of salt, which during the holiday season is more apt to happen, then you better drink extra water to kind of compensate that to keep your blood from getting inappropriately thick associated with.
absolutely. Yeah, very important to have that balance.
So those are the top two important things. And we certainly can get into many more aspects of this. I put patients, now nutrition, number one, right? Whole food, plant-based, organic, diverse, local, fresh is what you want to focus on. And again, plant-based is best to go that route. And if you consume animal products, wild salmon, sardines, would be higher on the list. I'm okay with goat yogurt. It's a good source of protein and lysine. Lysine protects against invasiveness of tumors.
Hmm, interesting.
So, you can use some goat yogurt with a few blueberries. Would be good on the protein side of things. With meat, limit red meat to once a month would be my recommendation, and kind of minimize or avoid poultry, chicken, turkey, for example. If you may look at your eye color, right? If your eyes are blue or very light colored, then that means you have Northern European ancestors, and therefore you may want to, you're more adapted to having animal products in your diet. So those individuals may need more animal products. Whereas if you have ancestors from the equator, then you had access to fruits and vegetables 24/7. And so vegetarian diet may be most appropriate for those individuals.
Yeah, absolutely. We need to eat for our uh, body type. I know some doctors who treat cancer integratively will go as far as doing some genomics on their patients too to tell them how to eat best because that's important. We need to customize these things. There's no one diet fits all for everyone. We're all different in so many ways, our genetics, our microbiome. So having more information is usually helpful in those sort of situations.
Yeah. And you and I have, to some extent at least, what I call the God gene. And that's the COMT Val 158, if you're familiar with that particular one. Half of us in America have the COMT one mutation of that, and maybe 10% have two mutations. With that mutation, we don't metabolize dopamine nor epinephrine. Epinephrine is readily. So whenever adrenaline kicks in, it kicks in harder, it lasts longer than normal. So we have a good on switch, but not a good off switch. So I suspect you're like me. You like to stay busy. You're workaholic,
Oh,
uh,
yeah,
cross the T's and
definitely.
dot the I's, perfectionist in terms of what you do. You like to keep things kind of orderly. And then the other characteristics of that is you are very caring. You give and give and give. Don't always feel appreciated. Can have any resentment tied in with that. You're more of an empath. Get around negative energy. You don't do well. You might go into certain shops and say, "Ooh, have to get out because of the negative energy." You also intuitive. You read people's energy instantly. And some individuals, you can stand next to them and know far more about them than they would ever want you to know. And that's a gift. Also, by the time you're an adolescent, you probably had a certainty of a higher power. In other words, it wasn't a faith in a higher power. It's like you shook hands with the creator. And you had a knowing in that. And that's a gift. The baggage is you've been in fight or flight most every day your whole life. Your adrenaline's kicked in most every day your whole life. And so that has put you at higher risk for chronic fatigue fibromyalgia issues, for example, and other issues. The COMT is a detoxification pathway, so you don't get rid of toxins readily and you don't get rid of estrogen metabolites. And because of that, you're more prone to high estrogen issues, which obviously includes for you would be female issues like fibrocystic breasts, ovarian cysts, but also premenstrual symptoms. So those would be anxiety, the days leading up to menses. Women with this gene mutation have anxiety, panic, obsessiveness, phobias, sleep disturbance, irritability, carbohydrate cravings, swelling breast, soreness, tenderness, migraines, every periods, cramping, bloating, brain fog, aches and pains in joints and muscles.
If you like this discussion, please hit the subscribe button and consider leaving us a review. It really helps people find us, and we truly appreciate your support.
I do.
Just a few things, not a lot. I
Right.
think I've heard that referred to as estrogen dominance and some more of the,
Yes,
lay people
exactly.
terminology, but
Yeah.
it's something that it's very important. So many women live with these symptoms, and there's a very straightforward scientific explanation for it.
Yes, absolutely. And there are other pathways that promote estrogen dominance. One is the methylation pathway, MTHFR, folic acid to folate, and then B12 is part of that pathway that generates S-adenosyl-methionine, SAMe, which can go to glutathione. Glutathione is like Velcro attaching to heavy metals and chemicals, and including estrogen metabolites. So if you have an MTHFR gene mutation,
Mhm.
and that's going to inhibit your ability to detoxify toxins, heavy metals, and estrogen. So SAMe also, the S-adenosylmethionine, also metabolizes adrenaline. So it goes back to the COMT pathway. So if you don't generate enough SAMe because you have an MTHFR gene mutation, then you don't get relaxed because you're not able to metabolize adrenaline in that COMT pathway.
Mhm.
And there's a third pathway, the CBS transsulfuration. I apologize for the big words. This is the pathway from homocysteine down to glutathione. That's what I call the dream pathway. Vitamin B6 is the primary cofactor. And so I ask my patients at the first visit, how many nights per week do you remember that you dream? And, sometimes they say, well, I don't dream at all, or just 1 or 2 nights a week. That's a functional vitamin B6 deficiency. And that means that key detox pathway is not working, meaning you're not getting rid of estrogen. That's a pathway, incidentally, that generates CoQ10 and taurine, two important nutrients. And the cause of that can be due to CBS gene mutation, but more commonly, it is due to excess oxalates. Oxalates are in spinach, Swiss chard, think kidney stones. 80 to 90% of kidney stones are calcium oxalate stones. So, for example, I had plantar fasciitis and arthritis in my hands. I limped around for 9 months till I figured out it was my spinach smoothie. I was eating
Mhm.
every day. I was eating an ounce of dark chocolate every afternoon, and I was eating too many berries some days. That was what was causing my arthritis and plantar fasciitis because those are high oxalate foods, particularly the spinach. And so the oxalate crystals are like needles and they puncture the joints, they puncture the muscles and cause aches and pains. So fibromyalgia patients and patients who have joint issues, half the time find that oxalates are a major factor associated with that. So oxalates are metabolized by that CBS transsulfuration pathway, homocysteine to glutathione. And Roundup, which anytime you eat food that's not organic, just about, you're getting Roundup.
Mm-hmm.
Roundup kills off the lactobacilli. It also impedes folic acid conversion methylfolate, and it generates oxalates. So you're more apt to get into oxalate problems in relation to cancer. For example, on a breast biopsy, they always see more oxalates when it's malignant on the biopsy than they do when it's benign.
Wow,
So,
that is so interesting. Yeah, because like you said, it causes problems in at so many different levels. It's the microbiome. It's our detox. Oxalates can affect so many different parts of our health.
yeah. And so when you get a vitamin B6 deficiency, because that pathway you're trying to burn through those oxalates, get them metabolized, and you burn out of vitamin B6, you run out. And without vitamin B6, you're familiar, I think, with integrative mental health issues and
Mhm.
how important vitamin B6 is in
Yeah,
that
definitely. That
category.
serotonin can go to what is it, kynurenate and quinolinic acid if you don't have enough
Yeah, it's
B6.
tryptophan, right? That can go to
Yeah, tryptophan.
quinolinic
Correct.
acid and kynurenine instead of going downstream to 5-HTP into serotonin.
Correct. Yes.
With that. So yeah, P5P, the active form vitamins B6 is key in that pathway, but B6 does something else. It converts glutamate into the calming, relaxing GABA, GABA. Yeah,
Hmm.
think with glutamate, think MSG, monosodium glutamate in Chinese foods, right?
Oh yeah.
It's an excitotoxin. It can trigger seizures. It can trigger
Hmm.
anxiety. And a lot of us have GAD gene mutations that already impede that pathway from glutamate to GABA. But B6 is the main cofactor. So if you're not dreaming every night, you're not likely converting glutamate to GABA and therefore are anxious. So those are three different pathways where you have higher estrogen because you're not generating as much glutathione and you're overstimulated. One, because you can't metabolize adrenaline appropriately because of CMT. The second, because you're not generating SAMe to metabolize adrenaline. And the third, because you can't convert glutamate to GABA. All three high estrogen overstimulation. So when I have a new patient that comes in, if they're anxious, fidgety, nervous, dressed perfectly, voluminous notes, perfect handwriting, I know just out of the gate that they're estrogen dominant, and those are the three primary pathways that I think of uh, generating estrogen dominance with them.
Yeah, that's so interesting and such a common problem too, that
Mhm.
it's good to know from a biochemistry standpoint what's going on so we can best address those things from a root cause and not just, the typical knee jerk, let's put you on some Zoloft or those things, right?
Right. Absolutely. Yes, you do not want Zoloft. And in women over 50, SSRIs are associated with a 32% increased risk of death, a 43% higher risk of stroke, and 110% higher risk of hemorrhagic stroke, doubles risk of bleeding, doubles risk of fractures, quadruples aging of your carotid arteries. And a report in the New York Times just a few months ago reported a case where a woman with a single dose of an SSRI got a numbness of her clitoris for lifetime. Okay.
Oh
And
wow.
97% of individuals on SSRIs have sexual dysfunction and they're addicting beyond that. So, fortunately, there are a lot of natural ways like inositol. Again, inositol at 4,000 every 8 hours was found to be equivalent to the SSRI antidepressants, and it has a lot of positive benefits instead of negative.
Exactly. It's not just that one benefit, but has all these
Yeah,
other things that it's also going to help you with. So
absolutely.
definitely much, you know, we should be considering this before we just have that knee-jerk reaction as physicians to put people on SSRIs.
And let me mention real quickly. I know I'm kind of hogging the conversation
Oh
at times,
no, this is wonderful.
but okay,
I like stepping in to tell you a little bit of what's going on, but this is just an amazing conversation.
good.
This is really cool.
So my receptionist, who had been hounding me for months to put her on an SSRI because she was feeling a little bit down, I finally relented and gave her a Zoloft. And the next day she came in and she said, I could shoot you, I could shoot me. I
Oh no.
just don't care. One dose of Zoloft, and she already, could murder someone. And, the very first mass murders that gained a lot of publicity, Louisville, Kentucky, near where I live, uh, Prozac, when it came out, there was a mass murder, and the question was raised, did Prozac allow that mass murder to occur? And it
That's
was
scary.
debated, should Prozac be taken off the market? And of course, we know the end story of that. It was not. But how
Mm-mm.
many mass murders have occurred since that time? And because of HIPAA regulations, you don't get to find out. But nearly all of those individuals are on psychiatric medications, which disinhibit them, which keep them from refraining from shooting someone or shooting themselves.
Wow. So sad, so scary.
Yeah. And so to get on with cancer, um, I do comprehensive testing. So along with blood count, chemistry profile, and those, I look at platelet counts. I want platelet counts under control. I want the neutrophil lymphocyte ratio under control. And a chemistry profile, I want to be sure there's enough albumin. I target like 4.5. I want to be sure the liver enzymes are okay, and I want to see what that blood sugar is. Tumors love sugar. We need to keep that in line. I mentioned the D-dimer, fibrinogen, C-reactive protein, important because that's a measure of inflammation. We want to keep inflammation minimized. Two other tests that I like to assess are copper and zinc. And why is that? Well, estrogen is a problem essentially with all tumors, whether
Hmm.
you have an estrogen receptor positive tumor or not, because estrogen in excess promotes inflammation, autoimmune activity, and that promotes angiogenesis, growth of blood vessels and tumors associated with that. So, with my patients, I want to control those hormone pathways. Testosterone is metabolized one of two ways, either to estrogen or to dihydrotestosterone, which is 5 to 10 times stronger than testosterone, associated with acne, rosacea, associated with male pattern hair loss, with hair growth in unwanted places, for example, and men, prostate issues with that.
I know some
And
people try to take saw palmetto to try to decrease that pathway. Is that correct?
that is correct, absolutely, with that. And then the other pathway, testosterone to estrogen. And actually, it's my belief that 80% of the population has too much estrogen. Why? Because we process foods, number one, because of things like BPA in plastic water bottles that act
Hmm.
like
Yeah,
estrogen.
all those
Mm,
xenoestrogens, estrogens that come from
yes,
outside our body,
yeah.
and things that
And
we can't measure most of those things. So who knows? I mean, we can get an estrogen test, but how about all these xenoestrogens that we don't know, we don't have the science to measure at this point?
yeah, so when you go to the grocery, you want to go on a full stomach and shop the perimeter and avoid anything with ingredients,
For sure.
because any preservatives in there of those chemicals, where are they metabolized? Usually by the liver, and
Hmm.
that's what also metabolizes estrogen. So in essence, all these preservatives, all these toxins, every heavy metal, they're all estrogenic, xenoestrogens, as you pointed out. So I think 80% of us, and also incidentally in fat cells, we convert testosterone to estrogen. So for all these reasons, I think 80% of the population now has too much estrogen. And because of that, that leads to excess sex hormone binding globulin, which binds up testosterone. So the amount of free testosterone, bioavailable testosterone, is deficient in most of us.
Hmm.
And
Yeah.
so with that estrogen, we're more anxious, but hopefully we're more intuitive as well, because I associate with that higher estrogen with increased intuition. It's about 10 to 1 females to males in terms of intuition.
At least, I would say.
Like, I can't say that I can argue that point at all with that. So we want to block both aromatase pathway, which is testosterone to estrogen, and the 5-alpha reductase pathway, which is testosterone to dihydrotestosterone. How do we block those downstream pathways? Number one, vitamin D.
Oh, yeah, that's true.
Now, when speaking to males, it's sometimes hard to get them to comply. So I always frame everything in terms of testosterone. Testosterone, excuse me, vitamin D in males boosts testosterone 20%.
Great.
So I tell my male patients, whenever you want testosterone, take your vitamin D. Whenever you prefer estrogen, leave off your vitamin D on those days, right? They
Hmm.
with fish oil. Days you want to grow your testicles, take your fish oil. Days you want your testicles to shrink, skip your fish oil. They hear that. They're listening
They hear
now.
that.
They
You
see.
got to phrase it the right way for certain
Exactly.
for
And
certain
then the other
people.
ones that block both pathways, turmeric blocks both pathways, the orange spice and curry. Zinc blocks both pathways. And the opposite of zinc is copper. And
Mhm.
so copper, by suppressing zinc, increases estrogen and increases dihydrotestosterone, which promotes prostate cancer, right? And so that's one key reason why those nutrients are so important. Resveratrol, quercetin, selenium, vitamin B2, green tea, or others that block both of those pathways to boost your testosterone. What does testosterone do? Again, most of us are low, so we need normal amounts. Testosterone reduces our waist size, it lowers
Mhm.
blood sugar, it lowers cholesterol, it strengthens our immune system. But guess what? It is anti-autoimmune. And a lot
Yeah.
of doctors, rheumatologists don't realize they think that anything that boosts the immune system is boosting autoimmune activity. That's not true.
Hmm.
Testosterone boosts the immune system but dampens autoimmune activity, which is why
Yeah.
vitamin D helps with every autoimmune condition because
Hmm.
it's
Yeah.
boosting
Yeah.
testosterone, it's blocking estrogen. Estrogen promotes all autoimmune conditions, not
Hmm.
only lupus, but really everything, allergies, irritable bowel syndrome. And so if I have someone who comes in with allergies, guess what else I know? I know 25 more things about them because I know they're not detoxing estrogen. And that partly is due to probably the God gene pathway where they can't metabolize adrenaline. So I can tell them, you're anxious, panic, obsessive, phobic, so forth. Days leading up to your period, you have five cystic breasts. You're hypersensitive, by the way. These individuals are sensitive individuals, more sensitive to foods, more sensitive to chemicals like odor and perfume, more sensitive to light, to noise often, and to electromagnetic fields and to mold. If you get a tick bite, more apt to have severe reactions to Lyme. That's tied in with that estrogen dominance that we were talking about, the highly
Hmm.
sensitive individual. But again, the gifts are you're intuitive and you have a knowing and a higher power. And, and that's a good compromise for the most part. And so getting in peaceful state is very difficult for those individuals, but it's especially important. Those are the ones that end up in my office because they're burning the candle at both ends. Their immunity gets run down, their cortisol kicks in, and they have all the autoimmune conditions. So they're the ones that come in with 25, 30 different complaints. And I point out with them, if you're paying attention, I said, the week after your period, all of those are better. The week before your period, all of those are worse. Okay.
Hmm.
So you know that hormones are a major factor in promoting all of those symptoms.
And
So,
their life is a roller coaster,
all right,
depending on the time of the month, which is not a fun way to live.
right. So with cancer, all of that's important too. So ideally, yeah, the initial time I will check an estrone sulfate blood level. You might have heard of DHEA sulfate, the storage
Hmm.
form. But the best way to assess for excess estrogen is estrone sulfate. And then I compare it to estradiol level. I want to keep that ratio 2 to 1 or less for the most part. I had a patient who came in to see me, said, "Hi, Dr. Roach. How are you doing? I have severe psoriasis. I went to Cleveland Clinic. I saw doctor after doctor. Nobody can help me there." What is her hormone status, right? Is she high testosterone or is she high estrogen?
Hmm.
She's
Probably
high
high
estrogen,
estrogen.
right?
Yeah. Yep.
And so I've checked estrone sulfate levels up to that point. The maximum, on the LabCorp testing is supposed to be 390, and I've had levels of 1,000 in some other patients. But when
Oh,
I
wow.
checked her estrone sulfate level, guess what that was? 5,000, right?
Oh, my.
So guess
Okay.
what's driving our autoimmune issues? It's that high estrogen that
Hmm.
was driving that. And of course, tied in with that, her testosterone, her free available test was, in the basement.
Hmm.
So when I brought those hormones back in balance and then addressed nutrition, digestion, and intestinal health, all of her psoriasis started melting away and her other autoimmune conditions. So you
Absolutely.
don't always have to do a lot of testing. If you hear a real high-pitched voice, you know what the hormonal status is, right? And if you hear a real
Yeah.
bass voice, you know what the hormonal status is as well.
Yeah.
So
Yeah.
that should be part of all of our examinations with patients is to pick up on those signals.
Yeah, yeah, I've had like some really good success stories in autoimmunity where people do minimal testing and minimal interventions. I had this one patient, she had rheumatoid arthritis, had because she doesn't walk with me anymore, uh, and the only thing she did was take an over-the-counter supplement of DHEA and some over-the-counter stuff to block her aromatase, which I think was zinc and quercetin, something like that, and green tea.
Exactly.
And she went back to a rheumatologist, and rheumatologist took her off her RA medications because she was so much better controlled. And so it's, yeah, what you're saying as far as making sure those androgens and the estrogen is balanced out is so crucial. And even little interventions like that with things that are over the counter or natural things can help patients so much.
Right. And so, yeah, I use DHEA and zinc in that regard. And now, before you listeners try DHEA, remember it's a weak hormone. So you want to be up to date with your female exam in the last 12 months before
Yeah.
you take a hormone. But if you're up to date, then, and I'm not your physician, but if it were my sister and it's not contraindicated, I would recommend like DHEA 5 mg 2 to 3 times a day. And then zinc, say 50 to 60 milligrams with the largest meal, say supper, so you don't get nausea from it. And
Hmm.
then you could go up higher doses. Now, if you get too much DHEA, I've had patients in that category that call my front office and curse them out. So that's too much DHEA when that happens. If you get acne, if you're
I'm,
growing hair
I'm
on your
actually,
face.
yeah, I'm
Yeah.
actually surprised that
Yeah.
DHA is over the counter because it is. It's
Yeah.
an androgen and it can have side effects, and some of them can be irreversible. I've heard of women growing a beard, they go off the DHA, the beard didn't go away. So I
Mm.
definitely would advise people just to go out and buy it because we're saying it's over the counter. Doesn't mean go out and buy it. It means have that as a discussion with your physician. Is this something that I should be thinking about taking? And as physicians, we do have a way of measuring these things and knowing what your levels are. So just because something's over the counter doesn't mean you go out and buy it. But it's interesting, right? That we do have a lot of tools that doesn't not everything's a prescription.
Right. Yeah. And with cancer, so I get patients a peaceful state, I get my good nutrition, lifestyle, and get them spiritually grounded. And part of that is, quantum science has been around 120 years. E equals MC squared was 1905, I believe, when Einstein said energy equals matter. So it's been around for a long time. And the thing is that quantum physics only works or can be explained is if you have the presence of a higher power associated with it. Okay. And let me mention about the double slit experiment. I think that's a really key experiment to understand. So this was done 60 years ago, right? So this isn't brand new. It's not untested. It's known science. If you take a barrier and put two vertical slits and have a photosensitive wall behind that, and you take a photon, a little particle of light, it will go through one of those two vertical slits and make a mark. That's if someone's observing. If no one's observing, what happens? The whole wall lights up. Okay. Why is that? Because it's not a photon going through, it's waves that are traveling through. Now, if you take a video recorder and videotape it, what happens? You see one mark. If you take the
Turns
battery
back
out
into
of the video
photon.
recorder, but maybe put a tiny battery to make a little red bleep to make it look like it's being recorded, what happens? The whole wall lights up. In other words, those waves know when they are being observed. In other words, those waves have a consciousness,
Mhm.
which is huge. Because if waves have a consciousness, then this chair I'm sitting in has consciousness, this table does. Now, hopefully not the level of your consciousness and my consciousness, right? And
Yeah.
not anywhere near the level of the consciousness of the creator, right? Which is much, much greater than that. But everything has a consciousness. Now, research with Masaru Emoto in Japan, New York Times best-selling book, right? The two containers of water, he sent loving messages to one container and he sent hateful messages to the other container. He then froze it, sliced it, looked under the microscope. Where he sent loving messages, he saw beautiful crystals. Where he sent hateful messages, chaotic structure. He then just wrote on a piece of paper and taped it on one container, loving messages. He wrote hateful messages on another piece of paper, taped that on that other container, froze it, sliced it, looked on the microscope, the identical findings. In
Oh
other
wow.
words, water knows when it's being observed. So water has
Yeah.
consciousness too, and we're 70% water. So
Hmm.
again, every thought we have is impacting directly our health. So if we can control our thoughts, that is huge in terms of healing. And so learning unconditional love 24/7, learning gratitude 24/7, and then learning speak our voice, our third chakra, speak our wisdom, authenticity. Those are so critical. for all of us.
Yeah, absolutely. That's so powerful.
And uh, boy, I can go on and on about cancer. Let me mention about miraculous healings, because I think, if you have stage 4 cancer, what's the prognosis in that situation? Well, it turns out there are all kinds of strategies for healing stage 4 cancer. For example, I had in my office 2 or 3 months ago a new patient who in 2017 had stage 4 cervical cancer. And what she did was get on a juicing program, like the Gerson's protocol, where she juiced continuously for 90 days. And she did coffee enemas 3 times a day for 90 days. At the end of 90 days, she was cured. She was well of that. I was at an event in Philadelphia and met a woman who's Columbia University postgraduate student. And she had had, I recall, ovarian cancer, and she went on a raw food diet and maintained that, and she cured hers with the raw food diet. I had a speaker at my conference about 14, 15 years ago whose wife was sent home to die with stage 4 breast cancer. She'd had surgery, chemotherapy, radiation. And what they did, she fasted for 11 days, then fasted for 10 days. And for that whole period of time, for the 21 days, he read positive energy literature to her while she was awake and while she was asleep. At the end of 21 days, she was well. You can go there, and outside of Columbus, Ohio, there's a spiritual physician healer from a Catholic background, and he's had a lot of success in healing. His name is Isam Nema, Issamnemeh. And for decades, he's been involved in spiritual healings. I've even sent a patient up to him. I had a patient from New Jersey who came down to see me with HER2 breast cancer. And so she ended up going and visiting with him and got some good responses with that. And then came back to see me 2 years later. I hadn't seen her 2 years, stage 4 cancer. I didn't know what I was going to walk into when I walked in the room. She jumped out of the chair and came over and hugged me and said, "Hi, Dr. Roach." How are you doing? And then I use an herbal chemotherapy, if you wish, herbal cytotoxic formulations in my more advanced patients like that. So I put her, so felt great. She looked great. You couldn't tell she had cancer, but her numbers were still high. So I put her on my cytotoxic herbal chemo, if you wish, Artemis Plus, it's called, and along with many other things, 1 week on, 1 week off. And then we did blood work about a month later, and all of her tumor markers came back down to normal. So, she'd been stage 4 for years, and through these strategies is doing very well. I had a prostate tumor patient in just Monday. He'd had recurrence of prostate tumors after treatment, and I put him on a full protocol. We tried sending him to Florida for cryotherapy. That didn't work out. So he was on a good regimen, but it wasn't working. I added one thing. I added melatonin, 60 milligrams, 4 times a day.
Oh,
And
that's a
guess
high
what?
dose. Wow.
That was high dose. And you would think he'd be sleepy all the time, right? But the reality is, as long as there's light, you don't get sleepy with melatonin.
That's true.
So
Yeah.
that stopped his PSA from rising. And guess what? It's been 2 years, and it'd been a year since I checked his PSA, and it dropped from 2.1 to 2.0 over the last year. And all his other markers were better too. So just, melatonin in that stage 4 scenario brought him under control. So there are a lot of different strategies to manage that. The key thing is, I think, convincing the creator that there's a reason you need to hang out here on Earth.
Yeah.
That you've got this, spiritual mission you need to fulfill, that you can help create heaven on Earth. And so as long as you have a purpose, that's fine. And that purpose doesn't have to be a grand purpose. It can be as little as saying a kind word to everyone you meet or smiling at everyone you meet. Just doing that. And then some people are just so, like yourself, you're in this category to some extent. You kind of glow with spiritual energy, and just your presence blesses people because of that spiritual energy. Yeah, you're a spiritual person. You know that. I don't have to explain that to you. And you're blessed by that. You're cursed with that fight or flight. But but just your presence is healing to individuals. And so there's so many out there that are in that category that just their presence blesses others. And that, so I think there's room to negotiate with God. You can say, well, I'm glad I get to graduate. I appreciate that, but I've got this work to do to create heaven on earth. So let's talk
Not
about
finished
this.
yet.
And I
Yeah.
think, you can negotiate in that way. Set that intention. What is it that you want to accomplish that's going to make the world better? And let that be known every morning before you get out of bed, every night after you go to bed. Let that be known, and your thoughts create that reality with that.
Wow, that's amazing. That's beautiful. I think those are just great things for our listeners to understand. Sometimes we feel like healing has to come through a certain intervention, a certain prescription, but no, there's so much of the healing that can come from our thoughts and the little things that we do. So that's really really amazing. This is such a great conversation. I could talk to you about this all day, but we are going to have to finish this at some point. So to try to start wrapping things up. I want to thank you for being here. This is amazing. But before I let you go, I want you to tell me and our listeners all this was amazing. I'm going to go back and look at my notes and look stuff up for days after this. But if you have just three things what would the three main takeaways be from our conversation today about cancer and holistic healing of cancer?
Number one, peacefulness. There's nothing to fear. Nothing to fear. The downside is ultimate bliss for infinity. All right, our souls survive forever, so there's no reason to be fearful about anything. If we get to graduate early, there are guardian angels that are looking after our
Mhm.
children and others. They're taken care of, and they're supposed to learn lessons. Right? It's not supposed to be easy street. Children of rich kids, they have everything, but right, they're bored to death, and they get all
Oh
kinds
yeah.
of trouble.
It's a
So
curse sometimes.
yeah. So we're supposed to have these lessons. And my patients with cancer, for example, I had a stage 4 breast cancer patient came to see me in 2017. She ended up with 12 chemotherapies. She finally transitioned in January. And she said, this isn't a path I would have chosen, but I would not have changed a thing. It's been so valuable. I've learned so much from this. So, with this diagnosis, it's an opportunity to learn, to gain more wisdom, to grow your soul. So it's not a mistake. It's not that you're unlucky. It's your opportunity to grow in this process. So number one, we need no reason to fear being in a peaceful state.
Right.
Playing helps with that physical activity lifestyle. Number two, circulation. You don't want to have a heart attack or stroke. So,
Hmm.
hydration, fish oil, and then in certain scenarios, in most scenarios, you want to consider systemic enzymes under the care of a practitioner.
Yes.
And probably the third thing would be more lifestyle. Being in a positive energy environment, doing what it is that you love to do, getting that hour of physical activity in every day, getting to bed on time, getting a full night's sleep with that, being around people that are nurturing and cultivating, and eating, organic, whole food, plant-based, fresh, local, diverse diet. So those would be my 3 points.
Excellent. I love that. I think that's uh, great knowledge for our listeners to take into account. And I, like I said, I'm going to listen to all of this again and take more notes. And I think all our listeners will have to listen to it several times to get the
Sure.
full benefit of all this amazing knowledge that you're bringing to us. And that's just one of the few things, I mean, sorry, one of the many things that you are super knowledgeable at. So I'm going to have you on again in the future. I hope that's okay because this has been an awesome conversation. Thank you so much for being here,
Yeah. Can
Dr.
I talk about my books just briefly?
Go
I've read
ahead. Yes, tell us
three
about them.
books. Yeah. The first one was God's House Calls, which has over 200 stories of my patients with spiritual near-death experiences and transformative spiritual events. It was number one on Amazon in 4 categories when it came out. My second book, Vital Strategies in Cancer. So if you want to get a fuller understanding of cancer, when I brought that out about 6 years ago, was probably the top integrative cancer book in the country. It was endorsed by Mark Hyman, who may be the top doctor in the country. He's a New York Times bestselling author for many times over. My third book, Brilliance, Pursuit of Hope, Wisdom, and Divine. So that's optimal mood, optimal mind, optimal connection with the divinity. And most recently, I wrote a chapter in a book called Awakening Stories, edited by Alison Brown, on how I came to the point of understanding, the creator and the universe, and understanding that, we have nothing to worry about. So those are all good publications. My website's, drroach.net, drroach.net. And that talks about a conference that I have every year. And also you can sign up for my monthly newsletter. I strongly recommend that you do that, where I share the latest research in integrative strategies, but also share a spiritual story and spiritual insights with that.
That's
And
wonderful.
also,
Yeah,
the midwaycenter.com is my office website. So
right.
feel free to connect in, and there's a lot of good reading to consider.
Wonderful. And so your books are on your, we can get those through your website, through Dr. Roach.
Well, yeah,
correct?
they're available through Amazon, but if you'd like me to sign a copy for you, you can contact the office, and we'll ship you a signed copy.
That's amazing. Well, I will definitely be doing that. I hope that a lot of our listeners do that also. Thank you so much for being here.
Well, thanks for the invitation. I really appreciate it.
Thanks for listening to Truly Healthy MD. I'm Dr. Monica Jauregui, and I'm so glad you joined me today. Remember, your health is in your hands, and every choice, no matter how small, can move you closer to feeling your best. If you found today's episode helpful, please subscribe, share, and leave a review. It means so much to me. Until next time, take care of yourself and stay truly healthy.